Good afternoon, everyone. Thank you so much for joining in our fifth webinar under the Healthcare Insight series.
Infection control.
ಯಾವುದೋ ಬೆಂಕಿ ಬಂದು ಓಪನ್ ಮಾಡಿದ್ರು.
You are muted, madam. You are under mute.
Good afternoon, everyone. Thank you so much for joining in our fifth webinar under Healthcare Insight series. I humbly request everyone to keep your mobile phones, mics and the videos off in the session so that it cannot hamper the flow of thoughts of the speaker. I humbly invite our esteemed speaker, Dr. Saril VS, who is the chairperson of CAHO Global Rehab Quality Forum, which is a unique platform for enhancing quality in global rehabilitation landscape. He is also associated with Sakra Ward Hospital, Bangalore as an assistant general manager for quality and business development. He is a certified robotic rehab specialist as well as HBOT licensed safety officer. His Kaizen projects has won national and global Kaizen championship awards.
You're on mute,
And also,
You're on mute. Excuse me.
I'm not on mute. Please keep yourself on mute. Am I audible, Dr. Saril?
You're
Yes.
audible.
Yeah.
Yes, you're audible.
Thank you. So I was just introducing his Kaizen projects, which has won national and global Kaizen championship awards, and also DL Shah Global Award from Quality Council of India. Today, we all have gathered to provide insight, to get insights from Dr. Saril's esteemed experience and expertise to learn Kaizen concepts from a senior leader from Toyota's healthcare vertical. Thank you so much, Dr. Saril, for joining in and spare your valuable time and consider Healthcare SSC platform to give your valuable insights to our audience. So I'm once again humbly invite you to come over and take over the stage, and please proceed with your webinar. Thank you so much, sir.
Thank you. A warm welcome. Namaste. Utkar Samades to one and all. Thank you so much for sparing your time. Let me just do a screen share. Is my screen visible?
Yes, Dr. Saril, it's visible.
Yeah. Okay, just a second. All right. Thank you, Healthcare Sector Skill Council and CAHO for this wonderful initiative. It's a great platform. If at any point of time, if you have a query, please feel free to write it down. We could discuss at the end of the session. Okay. Without much ado, let us start with the session. The journey for quality excellence called Kaizen. I'm Dr. Saril, as already introduced. Thank you, Dr. Megha Agarwal, for a lovely introduction. Quality is never an accident. It's always the result of high intention, sincere effort, intelligent direction, and skillful execution. It represents the wise choice of many alternatives. This statement sums up the essence of Kaizen ethos and the thought or a philosophy. And today we are going to see how this entire philosophical idea can be implemented in the healthcare sector. We would like to cover what is Kaizen, why Kaizen approach, how to do a Kaizen in a very systematic manner, And how can we develop a Kaizen mindset in ourselves as well as our employees or the people who are working with us? What does Kaizen mean? There are two words over here, which is a Japanese word. One is Kai and the other one is Zen. And they mean, in English, Kai means change, Zen means good. So put together, they can we can give a meaning as change for better. As everybody knows, change is inevitable, right? But change for good, change for better is all that we all aspire in life. So Kaizen is a methodology which can be applied even in your workplace, but most importantly, it can be applied in our own lives, and we would have a better lifestyle. What is expected in Kaizen? First and foremost, improve our approach to problems. So Kaizen, the more and more we involve ourselves in Kaizen, we will develop the problem solving skills, improve our daily work practices, improve our performance and outcome, our reputation, right? What are the key principles of Kaizen? Continuous improvement, encourage ongoing learning, growth, and progress. Customer centricity or a patient focus, focus on the customer needs as the first one, keep them above your own and their satisfaction. Long-term thinking, prioritize long-term success over short-term gains. Process focus, improve processes, not just results. We can improve every process that is involved in our day-to-day work. Data driven, use data for informed decision making. Without data, we cannot approach Kaizen methodology. Small steps, this is the crux of Kaizen. Break down big changes into smaller, manageable steps. So one step at a time, as how they say it. So small steps on a continuous process. Standardize and improve. Standardize the process which are successful, then continuously improve on them. Employee empowerment is the most important aspect. Involve and engage every employee in an improvement process. So Kaizen is never done by one project head or 2-3 people alone. You involve all the people who are related in the processes. So if there are many processes attached or dependent on your outcome, you try to involve as many people, that too from the ground grassroots level. And that's very important. Let us look at some of the potential areas that you can do in a generic way. Can we do streamlining of the workflows? So if there are process workflows developed, can we cut down on some of them, eliminate unnecessary tasks, or combine 2 or 3 of them together and then make it more efficient? Reducing the waste. So Toyota Production Way has identified 8 separate wastes. So can we do that or implement any recycling programs such as simple as reducing a paper usage? Reducing energy consumption. We can have a Kaizen activity around and installing maybe an energy efficient lighting or an equipment, or maybe attaching or a sensor based water supply system. Optimizing inventory management. Implement what we call it as JIT, just in time inventory systems, if that suits you. Improving safety protocols. For example, develop a new safety procedure to reduce the number of accidents if that is a pressing problem. Simplifying communication strategies. So implement a new communication or improvise on the existing communications tools or platforms, such as automation, or giving tabs to patients, or having an software for everybody to use. Enhancing employee training, develop new training modules to improve the skill sets. Enhancing employee engagement. So HR can come out with some Kaizen ideas to implement new recognition or reward programs. Improving customer service. So implement a new feedback system, or what we call as patient reported experience measures. So the feedback system is now changing out to PREM or PROM, patient reported outcome measures, and then study the impact of that. Now let us see more specific examples, or these are just suggestions. And I'm sure the idea is to inspire your thinking and your thought. So Kaizen ideas pertaining to healthcare sector, reducing patient wait times. So streamlining registration and triage processes to minimize delays, improving medication administration. So if you are in pharmacy or if you are a nurse, implementing barcode scanning or automated dispensing system. Some of you might already have the system, but please look into, is there a room for improvement? And that is the essence of Kaizen. We can never say that our systems are perfect, right? Enhancing a patient flow, the typical journey of a patient in an organization, optimizing the bed allocation and discharge process to reduce congestion, streamlining clinical documentation. For example, if everything is manual, you switch over to electronic medical records. Automation is a great way to improve or improvise our systems. Reducing hospital-acquired infections, implementing new protocols for hand hygiene, cleaning, and disinfection, improving surgical site verification, implementing new processes to ensure some accurate site marking and verification, enhancing patient engagement, maybe by implementing patient education programs, reducing readmissions. So implementing new discharge process or follow-up programs, maybe every 3 months a patient has to come up or we reach out to them through a tele program. Improving staff communication, implementing new communication tools or protocols to enhance collaboration, optimizing supply chain management, improving inventory management, and reducing wastage in medical supplies. This is a very, very important area actually. Now, this brings us to the most important methodology of Kaizen. We call it as PDCA cycle: plan, do, check, and act or adjust. PDCA cycle. Thanks to Dr. Edward Dumming for explaining it to all of us. In the modern healthcare system, we are trying to apply this from the industrial side. Let us see one by one. P from PDCA stands for plan. Identify and understand your problem or opportunity. Now, this is the first essential aspect. What is the pressing problem? So get a team together. We call it as a quality circle. Get all the people who are interested to contribute to Kaizen, to contribute to quality or patient safety. Everybody sit together. We first identify what are the problems that we have. It could be a negative voice of customer. It could be a positive incident that you faced recently. Could be some incidents which really affected the patient's life. So explore the information available in full, which means maybe we can look for literature review, what happened in other organization. We do a Gemba walk. Gemba walk means go to the shop floor where the action happens. We cannot always think in one place and decide everything in the boardroom. And interview the customer, interview subject matter experts, as many number of people as possible in the plan phase. Generate and screen ideas and develop a robust implementation plan. We can put it into Gantt chart. We will see more details very soon. Be sure to state your success criteria, like 1, 2, 3. These are the 2 or 3 things. If we achieve, we would be successful. And please remember to make them as measurable as possible. And that is setting a target. So all these activities have to be done in the first phase, which is a plan phase. And out of PDCA, the second phase is do, which means we cannot implement everything all together, especially when we are working with human beings, when we are working with patients or internal customers or our processes. So it is always good to test the potential solution safely with a small scale pilot project. So do phase is always about piloting it in a smaller population. This will show whether your proposed changes achieve the desired outcome with minimal disruption to the rest of your operational flow. Gather data. This is very important. In the do phase, we must gather data from the pilot population to show whether the change has worked or not worked. Use this data in the next stage. So plan, do, and the next stage is check, PDC. Check means analyzing the data. So we have done a pilot project, the results are out. So we are just going to evaluate what is this data telling? Is this really showing a positive change? Or we may decide to try out more changes and repeat the do and check phases n number of times. That's fine. But if original plan definitely is not working, return to the plan phase again. And we will look into the another solution. And the fourth and very important phase of the final part is act, or sometimes called as adjust. Take action based on what is learned. If the change did not work, go through the cycle again and again and again with n number of times. So quality is never a destination. We can never say that we have achieved quality in a particular process. It's always about finding the scope for improvement and working on them. So the fun of quality is in that, actually, is that you would find more and more room for improvement and to delight your customers at the end of the day. And if successful, incorporate what is learned into wider changes. We could definitely standardize. So standardizing comes as part of an act or adjust phase. PDCA is a loop, not a process with a beginning and an end. Now, improved process or product becomes the new baseline. We could be probably setting a new benchmark, or we can take a global benchmark or a local benchmark, but continue to look for ways to make it even more better. Use what you learn to plan new improvements, beginning a new cycle all over again. So PDCA is always called as a PDCA cycle because it's a continuous loop, and we always improve upon whatever has been done. This is a very important slide which introduce a fundamental concept of, do we need a continuous improvement versus what is this concept of slow progressive change called continual improvement? Now, if you have a continuous improvement, you have a start line and you straight away reach to a particular destination. Whereas a slow improvement, you will have PDCA cycles, which is shown more detailed over here, which will standardize for whatever you have achieved in that short span. And we standardize, we move on a little further, then we have next progress. Again, whatever is successful, we standardize it. So consolidation through standardization happens. The advantage of a continual process flow is that even if we fail, we only go back up to the last phase and we don't go back to the zero or square one. So there is always encouragement in the team. Everybody will be happy to kind of work. Okay. Now we venture into the systematic implementation steps as per Toyota way. These are the 8 different steps which we have to follow to achieve a consistent result every single time. Whether X is doing, Y is doing, it's always good to follow these steps. I request everyone to please mute. First one is finding the problem, breakdown of the problem, setting target, and then we analyze the root cause. We will see the tools that we can use, develop countermeasures, or we call it as Kaizen point, implement countermeasures, monitor process and results, and standardization. So these are the definite 8 steps. We will see one by one. I'm sorry, ma'am. Somebody's mic is not muted. Okay, thank you. Now we will get into the first one, finding the problem. As I told you, this is the starting point. We define the problem. Problem is the gap. So if you can see that a small image onto your left corner below, there is a current situation where we are at the moment, and then there is an ideal situation, and there is an ultimate goal. But there is always a gap between current situation and ideal situation. That is what we call as, or we visualize as explicitly as problem. So define the problem, clarify the problem as a problem statement. Select the problem to be settled, prioritize the problem. Now, many staff members might come up with maybe 15 problems or 20 problems. Please write it all down. All the problems listed down. We need to prioritize which one is a pressing problem. So what we do is we can use a charting or a Likert scale for impact, urgency, feasibility, expansion trends. These are some of the parameters that you can use so that at the end of the day, you would get which are the top 3 problems or the topmost problem. So identifying the problem is the first step. As we move on, the next one is to breaking down of the problem. Now you need to make it as measurable as possible, and you should make it visually presented. So here you can see in the example that we have put step A, step B, step C, step D, and these are all the various process involved in a particular process flowchart. And you identify that the problem is there in step C. This way, if you show in your presentation, it becomes very easy for all the stakeholders to understand where is the problem, and therefore they can focus on that. So analyzing on current situation by objective comparison means by area wise, profession, age, procedure, day, time frame, etc. Specify the point of occurrence. Check process through ground observation. In which process is the problem hidden? Now we move on to the next phase, which is a setting a target, which means, as I already hinted, it's all making it measurable. So set measurable, concrete and challenging, but feasible target, showing objective basis for the target setting. I'll give a very simple example. Imagine there are 3 pizza shops, pizza 1, pizza 2, pizza 3. A market analysis, they found that 73% of customer cannot be patiently waiting more than 35 minutes. But they decided the target of average waiting time is 30 minutes. Currently, it is 35 minutes, which means that they decided packing time should be shortened from 7 minutes to 2 minutes. So it will make 30 minutes in total delivery time. So that is a goal or a target that you're setting. So it's always important to measure and then tell that from this, we have to reach up to this particular level. Analyze the root cause is the next step. Write down the causes, as many as imaginable, through brainstorming. Sort out the causes and step into the root cause by using tools. I'll give you 2 tools over here. One is a fishbone chart. It's also called as an Ishikawa diagram. In an Ishikawa diagram, on to your left below, you can see in the example, we can use multiple root causes under certain headings called people, process, equipment, management, environment or mother nature, and materials. It's not necessary to have all the 6 headings. You can add on some other heading if that suits you, and you will have secondary cause, primary cause, but eventually you will come down to the problem. So this is how the root cause and effect analysis is done using an Ishikawa diagram or a fishbone chart. Another technology or methodology is YY analysis or a 5Y analysis. For example, why wait for the next process? Because there is another staff ahead. Why another staff is ahead? So you keep asking why until you come down to the root cause. The 2 very simplified ways of explanation for 2 tools that can be used in analyzing the root cause. The 5th step is developing the countermeasures or Kaizen point. Develop as many countermeasures as possible. Prioritize and select countermeasures. Expected effect, feasibility, cost in terms of economic cost, time or workload. So we can give certain scoring system this way, and we could prioritize which countermeasure, which solution can be implemented first. And if that solution is not suitable, it's not yielding results, we can always scrap it and try the second solution. So solutions are called as Kaizen point or develop countermeasures. And now, of course, now that we have identified the problem, we have break down the problems, we have come out with a root cause analysis, and to match that, we have come out with a possible solution. We need to implement it. So 6th step is implement countermeasures, which means prepare specific action plan, means who will be doing it, what has to be done, by when it should be completed. All this can be charted onto a Gantt chart, with all the details, issues, problems while implementation, if applicable. Did the countermeasure needed to be modified or reworked, if applicable? So this is 6th step of implementing countermeasures. Now that we implement the countermeasures, the next phase is we have to monitor the process and results. So evaluate the processes, whether it is going well, any points to be modified, evaluate the result before and after. Very simple way. We have key performance indicators identified during the plan phase or the result. We try to see that what is the situation before and what is situation afterwards. Secondary effect or side effect, if applicable. Now, this way we visually represent using the right tool. It can be a Pareto chart, it can to identify the problems, it can be a simple bar diagram to show pre-post, or we just make a simple tabular column which says that what was the numbers before and what is that we have achieved, what was the goal that we had to achieve in the end of the program. Now, show the way of standardization, how to sustain, how to prevent or returning to original situation. That is called standardization. So whatever is successful, we standardize it. And we should not depend on the individuals, but create a robust system dependent processes. And last but not the least, next activities or residual problem, if applicable. Show further activities or activities for residual problem, if applicable. Any chance of Yokoten. Yokoten means how do I take the success factor and implement in similar other areas in my hospital or my healthcare sector. If one hospital is established a Kaizen, can that be taken into the other branches of the organization, the sister concerns? That is called as a Yokoten. Okay. Now, in conclusion, we will have a before Kaizen situation and an after Kaizen situation. And we finally put down the benefits together. Okay. Now that we have seen through all the different points, let us just see the last portion of it, which is how to develop a Kaizen mindset. This is a very important part if you have to successfully establish in your system, in your organization. Everyone's participation and teamwork makes a culture. Wisdom of 5 is better than the expertise of 1, right? So please involve every single employee in the Kaizen journey. You never know, maybe a grassroots level staff would have a better idea because they are on the ground level. Throw away old fixed ideas on how to do things. Resistance to change is the huge enemy for Kaizen. Many people will have a resistance to change. So we have to really change our mindset first. We have to create a Kaizen mindset. And this is what I learned in Sakra World Hospital, working all these years, that we cannot be sticking our mind onto just the old systems. We have to throw away old fixed ideas and move on with new things. Keep asking why until you get to the root cause. Base decisions on the facts. This is a very, very important slide, very important information. As they say, in God we trust, all others must bring data. So every decision cannot be just because I'm the manager, I feel so, I have to do like this, or somebody else is saying that no, it has to done. There might be disagreements in the team, but it is very important to bring data and base our decisions on the facts. Correct mistakes as soon as they are found. And also make a foolproofing systems. We call it as Pokayoke. Okay. And very important in a Kaizen philosophy is don't wait for perfection. Very small improvement now, it's fine. And keep on focusing on small improvements until we reach our goal. Okay. And having no problem is the biggest problem of all. As Taichi Ono, the Japanese founder of Toyota Production System, has mentioned, this is a very, very important aspect. Many of us pretend that everything is fine. Why should I change this? Why should I change anything at all? Everything is going smooth. We don't have a problem. But that is the biggest problem of all, actually. So I really urge each and everybody, it's all about our mindset. We need to decide, we need to come together and form a quality circle and start working towards a common goal. And that is how we will be achieving success. The take home message is good processes create good results. Good processes create good results. Improvements are based on small incremental changes. Improvements must be measurable, standardized, and repeatable. Empower the employees. Okay? In nutshell, do it better, make it better, improve it, even if it is not broken. Even if nothing is seen as difficulty, let us improve it altogether. Thank you. And I will open the forum for if you have any questions at this moment.
If someone have any questions, so please write it down in under the chat box. Meanwhile, sir, they are asking the questions on the chat box. I have some
Okay.
questions from you.
Okay.
Sir, what is the role of higher management in Kaizen?
It's a very valid and very important aspect that you're bringing it up. As I said, the Kaizen is a principle which even the grassroots level staff can come up with. But the success definitely depends on a huge support from the higher management. And we are lucky to work in Toyota Systems, and I'm so proud to tell you that we have an excellent support system from the higher management. They really appreciate us. They really encourage us that it's okay to, okay, so if somebody is coming with, so every employee need to be empowered to come up with, they should not fear that, okay, if I tell this change, will I be targeted? Will there be problems and all those? You should work in a fearless kind of an environment where everybody gets an opportunity to contribute to the growth. And sometimes these results can yield, maybe a huge impact have in the entire organization or in the society. So yes, the higher management plays a pivotal role in supporting the staff in implementing the Kaizen in a systematic manner.
Thank you so much, sir. One question is coming up in the chat box that if you could clarify more with the healthcare related examples. If an example could you quote, sir?
Yes, sure. So ideally, you can take up any kind of activities. Say, for example, is there a particular field that you're asking in? Then I can customize it more further.
Sir, you could take any field. Maybe we can take the infection control or the CSS
Okay, sure,
department.
sure. So it is a constant, a problem for everybody that the hand hygiene numbers are not increasing in some of the staff. So one of the examples that I have seen in, which is done in our kitchen team, in the F&B team, because it's very important that they follow the hand hygiene. That's where the food is prepared. That's where the food for the vulnerable population is prepared. And imagine one of the staff came up with the idea when we presented this problem that of 1 week, we would observe it as a hand hygiene week. And maybe every 2 hours, there would be a bell ringing, and that bell is a reminder for all the staff to go and do a hand hygiene or a hand wash. Now, this is a very simple idea, right? But when you start doing that, you are positively reinforcing everybody. Of course, there will be a lot of halaballa in the beginning. It may not be well taken up by everybody, but the essence is when you see even your manager, everybody, even the senior most staff, everybody at that particular time goes to the wash basin and washes their hands. we are reinforcing a habit over there. And this simple activity, observing for 1 week, has improved the percentage adherence of hand hygiene. So you will have a pre-post data which says that how many times. So you need to have a ground observation and audit which really measures and gives this data before and after. So this is one of the examples that I'm telling you. So it can be as simple as that actually, but sometimes we think that, the problems are so big and we only think higher, bigger, larger ideas. It need not be innovative all the time. It can be just a process re-engineering, a process restructuring, or sometimes just eliminating a particular process from the entire process flow. We call it as lean management, right? So we can just cut it down to a simplified process flow actually. So likewise, I mean, there can be many ideas which are generated from healthcare, sections, or you can even have maybe all this while patients have been, the doctor was talking do's and don'ts after a knee replacement surgery. You could develop a handout, or you could even have a video which is run in the patient's room and everybody gets to see that. And probably it can be even the pre-operative counseling can also be made into a video format. So automation is a great way of doing innovation and Kaizen. So you can have such improvised ways of patient education or the family education, right? Or you can have a new movement, maybe about flu vaccination, maybe right in the lobby where all the patient relatives are being seated. One person could come and start meeting all of them and give a lecture. Now, this can be a small Kaizen point that you are starting it off actually. Okay.
One more query is coming up from Karthik Khatri, that how can the Kaizen culture can be created in a hospital nursing department?
Yes, sure. So as I told you, that sums up the entire presentation, wherein please involve every single nurse. Tell them, give them the confidence that we are here to support your ideas. So probably the best idea, or whoever comes up with an idea, there is nothing like a best idea, worst idea, nothing. As far as they give suggestions, we reward them. We give them as we make them as a smiley ambassador or something. We give them a small token of appreciation and really help them to come up with more and more ideas actually. Okay. And involve them, what we call as a bottom up approach actually, which means participatory approach. Involve even your intern. Sometimes they will be telling their fact on the ground. So involving every single representative and have at least a quality circle formed. I think the first and foremost thing is you look for who is already interested. Get all of them to form a nursing quality circle. And you tell them that you come up with some kind of Kaizen ideas, implement it. We will have an annual competition and we will gift you the best Kaizen project will get so and so award. This such positive reinforcement really, really helps them. But one humble suggestion is we need to handhold them. So as a person who gives the idea need not be the person who completely execute it. We have to get all the related departments, maybe pharmacy department, pharmacologist, doctors, supply chain department. Many departments together should come together, come down, sit together and discuss. So it may not be a good idea to have only the nursing department doing it together. It is always good to have multidisciplinary team involved in that, so that you will have a better acceptance by everybody and a larger success or an impact in the organization. But positive reinforcement is a great idea. And also let me suggest you can link it to their performance appraisal. This is just a recommendation. I'm not telling that you must do it, but you can link it to your performance appraisal or your monthly star performer or things like that, and then you can take it up actually, right? Or decrease the waiting time in the OPD or a patient's initial response time for a nurse to address, uh, or you just have a say a vein finder and there is a before after study that you do, or a continuous monitoring when you have an EMR applied, you have a before after study. All that is quality improvement activities. So Kaizen is basically any quality improvement activity where you will have a identify a problem and systematically try to approach it and solve it, and you measure the success pre post. If it is a failure, you go to the plan B. So it's very important to have plan B, plan C. So you need to have develop some Kaizen champions in various wards. So there would be nursing Kaizen champions who are in the different wards or ICUs, and those people are your key stakeholders. They would constantly be in touch with the ground staff to develop ideas, to come up with new ideas. When they have a roadblock, help them to come up with how to rectify that, come out of that, so on and so forth actually. So I hope I could throw light on some of the ideas. Yes.
Hello,
Right,
may I
sir.
ask?
Yes, sir.
Hello.
Yes, sir.
Hello, I am Dr. Dhiresh Choudhury, actually practicing geriatrics at Kolkata.
Ah,
First of all, thanks for your excellent deliberation.
thank
I
you,
have
sir.
learned many more things, and I am involved in home care services also. You
Great.
have mentioned, sir, one point, that is the achieving target.
Hmm.
So, or making target. Sometimes in the healthcare, the making target is sometimes not possible because of the mindset is not same from the other ends, like from the patient ends.
Yeah.
Like we have faced many times that we have scheduled some visits or home visits at the particular time,
Yeah.
but in one patient it takes much more longer time. What we have presumed that it will take 30 minutes, but
Yeah.
it may possible it takes half 1 hour like that. So
Correct.
the next patient or next the patient will suffer for the
Yes.
prior patient.
Yeah.
So this mindset from the patient's levels, it is also very important to achieving target. So
Yeah.
how can we overcome that sort of problems, especially wherever we are facing these problems? As because geriatric people, they are very much anxiety prone, and
Correct.
yeah, okay, that sort of thing, that sort of problems, mental disturbance, that sort of problems are going
Yeah.
on.
Yeah.
So how can overcome these problems? Whenever this mindset from the other end is also very much essential.
All right. So I'll definitely give my personal recommendation, but most importantly, congratulations, you have already identified the problem. So, you really know that this is really something that you want to achieve. And this is a pressing problem which is raised by multiple scenarios, multiple staff. Now we need to really sit down, involve the staff, everybody, to analyze that particular problem. And you already identified some variables. The mindset of the person is one of the variable which will go into the root cause analysis, which is your fishbone analysis. It's a person dependent problem, right? Now, if you come down to that as the root cause, now that may not be the root cause. I'm sure if you ask why, you might drill it down to another root cause. But if the mindset of the person is the root cause, one recommendation is to have a system to set the expectations in the very beginning. So you need to develop a robust counseling section where you should have very well trained counselors who set the expectation from the very beginning, that see, this is how we are planning and this is how it is set. We expected it to finish it within this much of a time. This is our target. Like let me give you this very interesting example. In Karnataka and the nearby city called Salem in Tamil Nadu, there are state-run buses, and this bus has written on front of that 3.33. Do you know what it means? It means that they're giving a quality assurance that a government bus is giving a quality assurance that in 3 hours 33 minutes, they will reach the destination. I'm sure how did they arrive at this 3.33? They would have done a lot of pilot, lot of studies, lot of brainstorming, and that's how. So arriving at a practically achievable target is the key. We cannot make a target just because in another city, in another place, in another hospital, a home care team is achieving at something. It need not be. We look at the last 6 months data. That's standard rule. That last 6 months, what is achievable for us, and probably keep that as our thing. We need to just maintain it in the first thing, and if we are maintaining in another 3-4 months, then we try to increase the benchmark a little bit better. So there are the key I would recommend you, doctor, is the mind flexibility. Just make it as flexible as possible for all the different ideas. Now, I'm just giving you one idea that you will probably start off with a robust counselor. There would be a patient counselor even in the hospital itself station, and who would go and set up. I'm sure you would have one, but you will have this point very clearly written and given it out to them that this is the time that is expecting. Just an example. But you try this out as a Kaizen implementation in the coming 3 months or 6 months. If it doesn't work out, we will have to brainstorm another idea. That's the essence of Kaizen, actually. It's never, we can say that this one thing is the solution for the problem that we have identified, actually. There can be multiple solutions. Now, it could be from the industry experts. It could be from your own staff who can really, so that's the beauty of Kaizen, that the ground staff who is facing the problem on a day in, day out, probably will come up with an idea, and then you try it out, actually. Hello, doctor. Are you there? I'm sorry, I'm not.
Thank you so much, Dr.
Yeah.
Saril. Thank you
Yeah.
so much.
Yeah.
We have a good number of questions in this session. Now we have some questions for the audience. We are now putting up our poll, and let's look that how much our audience was able to imbibe from this session.
Excellent.
Can we have the poll started? Yes, the poll is started. The timer is going on. So please, everyone, participate in this poll and give your answers.
और बेटा कितना है कौन सा ट्रेन का तो भी देखा नहीं है
Kindly
हाँ।
hurry up. 1 more minute and we will end the poll. So we are going to end the poll in another 10 seconds. So we are ending the poll here. So Dr. Saril, the first question was, do you think Kaizen is just a philosophical concept with no practical value? Maximum people answered with no. Kaizen can be used to increase efficiency. And some, sir, you are on mute, sir.
Wonderful. Thank you for absorbing the concepts. Yes, it takes time for us to change our mind. So when we say Kaizen, we need to first do a Kaizen for our own mind and our own thinking. But it is a philosophical concept which has huge impact, especially Toyota Production Way is attributing its success hugely to Kaizen. And trust me, ever since we embarked on this journey, it's a never ending process. We always look for what are the new ways of doing it, how we can better it ourselves. So we are like never satisfied with whatever one or two things. Actually, we want more. So that's the Kaizen mindset. Thank you.
Second question was, is it possible to improve every process? And
Yes.
maximum people answered yes. Few
Yes.
people have still answered no, but I think so the answer is a big yes.
Yes. Yeah.
The third was, service defects are usually the failure of system or people involved.
Yeah. That's right.
Maximum people answered with system. Few
Yes.
people, but still answered with people. Sir, what is
Yeah.
the better answer?
It's we have all been made to understand that it's always the system which causes the error. It's we cannot blame a person or a people for the error, the failures. Please develop a system dependent approach and not a people dependent approach, because due to healthcare attrition and things like that, people might change, but we need to establish a system. And it's always, trust me, more important to change or rectify the system than the people, of course. But the answer is definitely system, actually, and I agree with the majority. Yes.
Next question was, small changes can have significant impact. And
Yes.
the big yes. Almost all the people have answered as
Yes.
yes.
98%. Great.
Enhancing employee training could be a Kaizen activity.
Yes.
So maximum people answered with true. I think so it's true.
Yes.
Last question was, which is the best description of Kaizen? So maximum people answered with change good.
Yeah.
Few people answered with the process change. And
Yeah.
then few 50-50 was there for the change slow and process slow.
Yeah,
So
that's okay, because I understand that, trust me, it takes days, months, years to really imbibe the concept of Kaizen. It takes a lot of time to get into it. I'm glad that within this few minutes of kind of introducing into the topic, we have already absorbed the essence of Kaizen. It is always slow, changes are making good impact eventually. So change for good is what is Kaizen essentially mean, that we have to really change and it is for good. Thank you.
thank you so much, sir.
Yeah,
That
thank
was
you.
a really insightful series. And this was the top series where we got so many questions in
Thank
our
you.
chat that I think so few of the questions we were not able to address as well. But we would keep on doing this kind of healthcare insight series, and we could have the second follow-up session again with Dr. Saril, and to address you the real life examples as
Sure.
the public demand we have came
Sure,
across.
sure.
Thank
It'll
you
be my
so much,
pleasure.
Dr. Saril. That was
Thank you
a
so
really
much.
insightful session. Thank you so
Thank you.
much.
Thank you. Thanks a lot, everybody. And let us take the pledge that we will make the change and we will be the change agents in our organizations. Thank you.
Thank you so much, everybody, for sparing the time and joining in with us. Our next Insight series would be in October, and we would soon come back to all of you with our joining link. Thank you so much. Most probably, the next series would be on the clinical dietetics. Thank you.